you for Hello, and thank you for this opportunity to participate in Salute to Seniors virtually. My name is Dennis Del Pizzo. I am with the Centers for Medicare and Medicaid Services in Denver, and I wanted to talk to you uh, about Medicare and addressing some common questions that we get, and also, most importantly, assuring that you have the official resources and know where to go to get help. So Medicare.gov and the screen that I am sharing right now is the official Medicare website. You can also call us 24 hours a day, 7 days a week at 1-800-Medicare. And again, they are available 24 hours a day, 7 days a week. You might not want to call on a Monday through Wednesday during business hours because that could be very busy times. But if you call outside of those windows, you'll probably be able to get right through to a customer service rep to address your concerns or questions that you need assistance on. You can also get help locally in the community, and that is through um, this the U.S. Department of Health and Human Services provides a grant to uh, states, and those grants are administered by either the Department of Insurance or the Division of Aging and Adult Services. In Colorado, that grant is administered by the Colorado Division of Insurance, and it's called the Colorado State Health Insurance Assistance Program. And that's another place to get local, unbiased help and resources. The Colorado SHIP can be reached during normal business hours at 888-696-7213. And those of you know that you can also reach out to the Colorado Gerontological Society for assistance and help navigating the Medicare program as well too. But in the screen that I'm displaying is the Medicare.gov website. As I mentioned, it is the official source of information. And I just wanted to highlight some important information that can be found on the Medicare.gov website. And some of the important things that you see as far as if you're new to Medicare and getting started. If you click on this the green button below Welcome to Medicare, it'll take you to a tool that will kind of guide you through the information that you need, depending on where you are in your Medicare journey, just getting started and trying to enroll or needing some additional questions answered or addressed, and you're trying to find it online. Another key tool on this website is the Find Health and Drug Plan tool, which is in the middle of the screen here. And if you click on that, it's going to take you to a Medicare Plan Finder tool that allows you to either do a personalized search if you want to enter your information and if you've already created a Medicare.gov account, or you can enter your zip code, answer a few questions, and it's going to allow you to view plans that are available in the locality in which you reside. And a lot of times that's zip code or statewide basis based on the plan you're looking for. If you're looking for a Part D plan, that would be on a statewide basis. If you're looking for a Medicare Advantage plan, a Medicare Advantage are private companies that offer options to receive your Medicare benefits through these private health plans that agree to cover everything that original Medicare does, and they might provide additional services. But the Medicare Advantage plans are usually going to be based more specifically on locality, so it could be at the zip code level. And so the tool will allow you to narrow down your search, and it will also allow you, if you choose, to enter the drugs that you take, the pharmacies you use, And in the future, we hope to have the ability to also be able to add the providers that you use to your primary care providers, your specialists, to make sure that the plan that you are looking at, that your primary care doctor, which would be very important, or your specialists are within network. And so that is an important way to find out the plan availability and resources that are available for you to choose or select, or to compare further. And the tools allow you to compare plans and go into the plan details, or go into the plan's website from a link that's on the tool, or even reach out and call the plan. Another important information is you can also see where there is a button over on the middle right-hand side to talk to someone. And so that if you click on that, that would take you to important contact points that I just mentioned: 1-800-Medicare, the Colorado SHIP, how to reach your state Medicaid office if you need it, etc. Another really important thing that we always like to mention is how to protect yourself from fraud and how to report fraud. So this is a big taxpayer, the Medicare program, the Medicaid program are big taxpayer funded programs. And so we are the first line of defense. And so it's important for all of us to compare the notices that we receive when we receive services, and to compare those with services that you did see or appointments that you had, to make sure that they align, and that you recognize the service, the date, and the provider rendering them. If you have any questions, I would always reach out. Most providers practice responsible medicine. I reach out to the provider, but if there is just a mismatch, or the provider is from Florida and you were never in Florida, then that's something you'd want to report. And you would report that to 1-800-Medicare, and they would take information from you and to look into the allegation and the alleged fraud and or abuse, specifically based on you taking the initiative. Very, very important that we all do that, to report that. The other important thing on this slide is to make sure that when you schedule your annual wellness visit, or have appointments with your primary care physicians, that you review and utilize and obtain all the preventative services that are available to you. And so if you click on this tool, or this button, it would allow you to look at all of the Medicare preventive services that are available, what the frequency or utilization parameters might be, what the age restrictions might be, if there are any, and to ask your primary care physician what services, or if this service would be appropriate based on your family history, based on your situation, based on your circumstance, etc. And so that is another important thing to have available. And then we are always encouraging people to go digital. And so at your discretion, and only if you elect it, if you would like to receive the Medicare and You Handbook digitally and electronically versus hard copy, you can sign up for that. One of the other important things that I didn't mention on this screen is you can create a Medicare.gov account. You have to be enrolled in Medicare to create a Medicare.gov account, but it allows you, when you create a personal, individualized Medicare.gov account that you password protect and only you have access to, it allows you access to additional information. Do you want to set up easy pay if you are paying your premiums monthly because you're not receiving Social Security benefits. If you want to have access to your claims information or to see which Medicare Advantage or prescription drug plan you're in, the Medicare.gov account would allow you to do that. There's also a number of other additional resources that are available. And we encourage all Medicare beneficiaries to have a Medicare.gov account. It allows you access to a lot more specific information. It can track your Medicare preventative services and set reminders as far as when you are available for your next preventative service, possibly on an annual basis, etc. So we always encourage that too. Also in this search bubble on the top right-hand side, if you type in what Medicare covers and costs, you can get a listing of the services that are covered by Medicare. And it's a fairly lengthy service, and that would look like this. And so that's what I'm displaying after you typed in the search bubble, what does Medicare cover and what are the costs? And then you can click on these services and it's listed alphabetically, and you can understand how Medicare covers your services and what your costs might be. Another important thing, if you're worried or interested about Medicare coverage and cost, is also talking to your doc, your primary care doc, or your specialist, because a lot of times they know what insurance covers and does not cover, and they can help you or talk to you about Medicare coverage as well. Also, the last thing I want to show you on the Medicare.gov website is the publication tab. And so you can click on the Medicare publications tab, and you can get a number of publication resources that are available. It's located in this middle tab right here. And for example, some of the Medicare publications that are available to you are what Medicare covers and costs. And so this would be the cost for original Medicare. But there's a number of other important and more specific publications that would go into topics and areas that you might want more specific information. How does Medicare cover hospice? What is home health care and what are the coverage requirements, etc. What are the Medicare preventive services? What are any age and frequency requirements? And how often can I receive them? There's publications for that. This is just an example of the publication that are available. I just wanted to show you that to see what some of the examples of publications that you can get at. And then always remember, if Medicare, if you receive services and it is denied, always read your Medicare summary notice or the notice that you received from your Medicare Advantage plan. And you can always question that, asking for a reconsideration or appealing that. And that's your right to always question. And you can, I would always encourage you to work with an advocate, the Colorado SHIP program, the Colorado Gerontological Society, reaching out to your healthcare provider and their billing staff. And a lot of times they can help you too. If they said, no, this service should be covered, to make sure that you file and question Medicare's decision on and determination on the services you received if something was not covered. So always remember that. The few last reminders that I want to leave you with, and that is for the people that are applying for Medicare. Medicare enrollment, eligibility, and entitlement is all handled by the Social Security Administration. So we each have to go, every one of us has to go out to SSA.gov to apply for Medicare. We can file a Medicare only application, or we can apply for retirement and Medicare all at once. Social Security encourages, in the most efficient way, to apply for Medicare is online at the Social Security website. And remember to enroll timely. We're eligible to join Medicare when we turn 65, 3 months before, the month we turn 65, or 3 months after. If we apply 3 months before the month we turn 65, coverage will be effective the first day of the month that we turn 65. If we apply the month we turn 65 or any of the 3 months after, coverage will be effective the month after. So remember that, and also remember to enroll timely. Another common thing that people encounter or have questions about when they are applying for Medicare the first time is they could be working. And what happens if you're working and covered by an active employer plan that has 20 or more employees, or you're covered by a spouse who's actively working and covering you under their active employer plan that has 20 or more employees? If you are covered by that situation, then you can delay enrolling in Medicare and then enroll in Medicare timely once you retire and separate from your employer and your employer coverage ends, or if your spouse is covering you, they separate from Medicare, you're eligible for Medicare, they separated and they're no longer covering you under your employer group plan, that is when you'd want to enroll in Medicare. And you have 8 months to do that. It's called the Medicare Special Enrollment Period. But I never encourage people to wait the 8 months, and you always want to manage it. And so what I mean by manage it is Social Security cannot pretend to know when you or your spouse is going to retire. And so we need to let them know. If you're working past 65, give Social Security about 2 months lead time to process the paperwork. There's going to be a Part B application, and there's going to be a form that you have to complete and your employer has to complete that provides proof to Social Security that ever since you became eligible for Medicare, you maintained active employer coverage, either yourself or through a spouse. And as long as you do, Social Security is going to process that application and then make your coverage effective. And what I meant by managing it is that if you let Social Security know in advance of the date that you're retiring, or your spouse is retiring, if they're covering you, then your coverage can be effective the first day of the month after your employer group coverage ends, so that there's no gap in coverage, and that's very important. There is also one last opportunity to apply for Medicare. It's called the General Enrollment Period. It occurs the first 3 months of each calendar year, January, February, and March. But a lot of times when people are enrolling in the General Enrollment Period, you're basically telling Social Security, I missed my opportunity to apply for Medicare timely when I was first eligible or stopped working, and I'm utilizing the General Enrollment Period, in which you can do, but a lot of times there can be consequences. And the consequence is if you let 12 or more months go by where you could have enrolled and did not, there's going to be a late enrollment penalty. The late enrollment penalty is set at 10% for every 12 months that we let go by that we could have enrolled and did not. And it usually lasts for a lifetime. And it also can accumulate. Let 24 months go by, 20%, 36 months go by where you could have enrolled and did not and have no longer been working, 30% penalty. And we don't want anybody doing this, paying a late enrollment penalty. The other things that to think about too is to be cognizant is within this Medicare cost sheet, there can be higher premiums for people that have higher income. And within this Medicare cost sheet, and again, this document is updated annually. You'll see it's titled 2025 Medicare costs, but it lists the program costs for original Medicare, both Part A and Part B. Talks about the Medicare Part B premium, the Medicare Part B annual deductible. But here's where it gets into this income-related monthly adjustment amounts. And there can be adjustments. Social Security does administer this. And they look at your adjusted gross income and any tax exempt interest that you excluded from your adjusted gross income. That's called modified adjusted gross income. And Social Security looks at that to assess or not if you're going to be impacted. You can see if you're assessed income above $106,000 as an individual or $212 as a couple. These figures are adjusted annually each and every year. And you can see in the different thresholds, your Medicare Part B premium is going to be adjusted upward if you're impacted by this and have higher income. Social Security looks at this each and every year. It's not a permanent assessment. And Social Security is looking at that when they make the assessment at your most current tax return, which could be 2 years old. So be cognizant of that. And if you get assessed an income-related monthly adjustment amount penalty, and it's incorrect based on Social Security looking at your tax return, but it's not current information, you can always ask Social Security for a redetermination, or you can appeal that determination. And Social Security will review it based on the additional information you provide them on maybe a current tax return that they're not looking at, etc., or additional information you can provide that provides proof that your situation has significantly changed. So be cognizant of that. And then the very last thing that I'm going to leave you with is open enrollment period. So for people that are established, we can change coverage if we want to each and every year. That open enrollment period occurs October 15th through December 7th. And if you make a change, your coverage is effective on January 1st of the new calendar year. You're going to be getting the Medicare NU handbook here in the next couple weeks. And that will give you a sneak peek in the back of the book as far as the Medicare plan availability in the state that you reside at. If you live in Colorado, you get the Colorado specific handbook. And then starting October 1st, Medicare Plan Finder, that tool that I mentioned on the Medicare.gov website, would go live with information. And that's where you can start looking at shopping for and comparing plans, talking to 1-800-Medicare to review your current drugs, the pharmacies you use, etc., to determine if your coverage is still the most appropriate, or if there's a better deal switching to a different plan that would provide better coverage at a lower cost. So always remember, during open enrollment period, it's very important, and it's only to your benefit to review. If you're enrolled in a Medicare plan already, you're going to get a mailing around the end of October or the 1st of October from your plan, and it's going to be entitled, or it's going to come electronically entitled, the Annual Notice of Change. Review that document. Very, very important. How is your current plan changing for 2026, the new calendar year? For cost, premium, cost sharing amounts that you're going to be responsible for. Look at the networks. Are they changing? Is your plan changing the way it operates its network? And so make a note of that and review that. And also make note of, if you receive services that plan requires pre-authorization, you might want to check with the plan before enrolling and understand how and what the requirements are for your healthcare providers to pre-authorize services in advance. And that is usually through Medicare Advantage plans. Medicare Part D plans could have some utilization management tools that you have to meet, or your healthcare provider has to justify in order for a certain drug to drugs to be covered too. Not all drugs, not all services or tests require this, but it's always good to know that and to do your homework before, so that you make sure that if your plan is not making significant changes and you like that plan, you can continue on with that plan and do nothing at all as long as that plan is continuing into the new calendar year, or you can identify that there is better coverage at a lower cost available to you by switching coverage. Again, 1-800-Medicare is available to help. You can go out to Medicare.gov and that plan finder tool to get information and to do the comparison yourself. You can reach out to the Colorado SHIP program at 888-696-7213, or you can reach out to the Colorado Gerontological Society. And with that, I will conclude and thank you very much for the opportunity to speak with you today.